Hello everyone, I'm extremely delighted to introduce to you Dr. Anand. The NEET SS results have just been announced and I've got Anand with a wonderful rank 81 for the NEET SS Medical Group. Anand, first of all, hearty congratulations.
Thank you, sir. Thank you so much.
Anand, are you delighted with your rank first? Obviously should be.
Yes, sir. Yes, sir. I'm so excited with the rank. Actually, I didn't believe that such a great rank from because of the short. There's a short month of preparation for me, and so I'm excited. I have no words for that.
So Anand, the viewers would like to know more about you. So first of all, can you tell us from where are you, your MBBS college and your college for post-graduation?
Okay, sir. Sir, I am from Malappuram, and I did my MBBS in Government Medical College Thrissur, and I'm also lucky to have my MD Medicine in Government Medical College Thrissur itself. I'm a 2020 batch, and I passed out in 2023. And
Right, great, great, great. So Anand, just about your preparation. First of all, just tell us that how many months of serious preparation did you give for NEET SS exam?
Sir, the point is that after 2023 pass out, I didn't write the main exam. The
Okay,
2023 NEET test, I didn't give it because I wanted to do the SRship in my college, so that I
okay,
will be more in touch with the clinical case scenarios and all. And
okay,
we have a brilliant faculties in our medical college department of medicine, and I thank all of them because with their inspiration, motivation, it helped me a lot through my journey. And
right,
during the 2023 2024, after the SRship, when I finished the SRship on the November, then the dates are getting delayed and delayed. So
okay,
I was very confused when to start, where to start. So it's also very short. There are very few candidates who cracked within the second in the repeat attempt. So the point is that I myself said that I have to give a 3 months of preparation myself, so that I will be more in touch with Harrison, etc. So
okay,
I picked a DocTutorials app so that I can be more in touch with Harrison and more in favor of Harrison based questions, something like that. So the exam was on March the 30th. So 3 months before that. So January, February, and March. These are 3 months I was mostly in serious preparation.
okay. And which platform was your primary source of preparation? Were you using Doc as the primary platform?
Yes, sir. I used DocTutorials as a primary platform, so that
Okay,
it's more easy for me to access and also to get in touch with Harrison tables. But based on the previous 2023 to 22 NEET, it was mostly Harrison based. So
okay.
I wanted to be in depth in knowledge about regarding Harrison. That's why I picked DocTutorials.
Right. And just going through the resources in Doc tutorials, as you know that in Doc, I think the course is structured in such a way that there is something for everyone, which means there
Yes.
is you have got main videos, revision videos, test and discussion videos, Harrison's tables and flowchart videos, and obviously the question bank and the grant test. Because as we know that residents are quite busy, everyone may not be able to attend the main video. So first, I want to know from you, did this sort of a segregation actually help you in sort of revision, T&D, Harrison table? Did that actually help you?
Yes, sir. The point is that nowadays there is a lot of resources, so we are very confused how we have to approach. The point is that I went through my gut feeling that I have to prepare like this, and I also watched I also watched the previous rankers videos and how they approached, and also so I mainly picked the Harrison question bank, so that the question banks are the way to get more in-depth knowledge, so that we can understand our weaknesses and we can go
Right.
through what went wrong, etc. So the first the primary thing I used in DocTutorials is Harrison question bank, and based on the Harrison question bank, I understood my weakness, and I then go through the weaker areas in Harrison. I use the weaker subjects. I use the QRP videos and the Harrison tables and also.
Yeah.
And I went through the QRP videos in which I am more weak. That is in neurology and also in somewhat in cardiology and also nephrology. The weaker areas I focused on those on weaker areas, and I then seen those videos in fast, and then again went through the revising the Harrison question bank. So mainly I was using the Harrison question bank, and yes, sir, the
Right.
segregation was really enough because most of every candidate is different, so everyone has a different their own plans. So based on this segregation actually helped me in that, so I can select the things which I need. So
Right.
that actually helped me in picking the correct plan.
Right. And how useful did you find the exams that we did? Because a lot of exams we had conducted, Harrison-based mini test, the grand test. So how the series of exams helped you maintain the rhythm?
Sir, actually, that was really, really helpful because every week it means there is a frequent, in frequent intervals, there is a 10 question Harrison based mocks will be there. And that's actually keep us updating. Okay, I don't know this, and I can go back and read that. And or I can do the question related to that. And actually, that actually kept us in the competition actually. And we also the mock test, the uh, 2 week interval mock test also, because the mock test actually was based on the previous NEET scenario, and also it also helped which area is important, and I have to go through those weak areas and all. So actually the weekly that 10 question mocks are very important, very highlighted part in DocTutorials, and I'm really excited to talk about that.
Yeah. Because actually this idea actually came, in fact, because the exam was postponed, because we every time we do the LI test and discussion, but again, since the exam got postponed, many students said that they are losing their rhythm or momentum. So that
Yeah,
is when
yes,
I
sir.
thought, why not give short exams? Because see, even if you can increase the number of grant tests, if you give the candidates specific targets, at least they'll
Yes,
try
sir.
to finish it. We are
Yes,
all
sir.
busy, we have got practice, but again, at least you will try to finish those topics in that time frame and give the exam, and you get an idea, okay, how are you performing amidst all the competitors, right?
Yes, sir. Yes, sir. So actually, that every in the initial test, I got some questions wrong. Then the next mock we have prepared in such a way that we have to get all things correct, and then
Okay.
then the competition has increased, and actually it helped in the preparation, and we read Harrison more, and we go into the question banks again and the QRP videos again. So it's
Right.
actually helped in revision also.
Yeah. Because see, NEET is a very unpredictable exam.
Yes, sir.
The pattern keeps changing all the time. So you need to be very thorough, whether it be factual, scenario based. That is why even in the course distribution, we have put the questions of LI test and discussion slightly tough. Again, the 10
Yes,
question paper. So only if you keep that sort of a segregation, then only the students will get a feeling of, okay, having done the easy, medium, and tough range of questions. Because you would also agree with me, to your juniors who are listening to you, if somebody is
yes,
asking
sir.
you what is the exact pattern of NEET SS, will you be able to say a
Yeah.
concrete answer?
Yes, sir. Sir, actually, the current thesis was the first section A part was very unpredictable because the first three questions were very, very difficult, and it was not the pictures from the Harrison also. So
Yeah.
actually, but the point is that the regular examination, in the past 3 months, I have done many mocks, and I have also done many tests, and actually. Even though it was difficult, I found a way in which I can able to get the answers in between the areas, and by ruling out everything, etc.
Right.
And actually when we practice more, actually, even though it's difficult, we can be in the competition actually, at least.
Okay.
So
Right.
actually that's helped me a lot.
Yeah. And we had active WhatsApp groups as well, mentoring students, faculty
Yes,
groups.
sir.
I hope that also helped you.
Yes, sir. Really, really, sir. Especially sir's sir, frequent inspirational quotes that sir was giving in the groups. That was actually because we find, because it's in our late ages, and we have anxieties during the last months, and during that time the thing that we have to focus, that when the faculty say to us, that's very important, and that's very inspirational for us. And also, even though we have any doubt, also we can openly clarify it in the groups, and that was really and also it's also up to time also. When we post the question, the answers will be already will be there, and that regularity is actually helpful actually.
Yeah. So thank you so much, Anand, for your time, and I'm extremely happy with your rank. You've put in a lot
Thank
of
you, sir.
effort in such a competitive exam where the pattern keeps changing. Amazing rank, and hearty congratulations.
Thank you, sir. Thank you so much.
Right. All right. Thank you.